Hello and welcome to another episode of Conversations with Dr. Westman. Today we're going to be chatting about, our conversation is going to be starting keto the right way. Hey Eric.
Doing great. How are you doing, Glenn?
Very, very good. Thank you. Eric, I wanted to chat with you. I know this is a topic that's pretty dear to you. You've been helping folks fight chronic illnesses like type 2 diabetes, obesity, and other metabolic conditions in your clinic using nutrition as therapy for the last 15 years. You've had incredible success in reversing these conditions using nutrition as therapy. And I've often heard you mention that your method is more powerful than a prescription drug.
All right. Well, it's more powerful than many prescription drugs. In fact, I see it as a substitute for prescription drugs. You know, the current system teaches doctors how to use those, but this is as powerful or more powerful than many different drugs like diabetes, high blood pressure, because we can take people off those drugs by just changing the food.
Is this something that you commonly see in your clinic? I mean, for example, if you took 100 patients that you see, and if they followed your program to the T, how many of them would be able to come off their diabetes medications, their hypertension medications, et cetera, et cetera?
Yeah, just about all of them. It's pretty amazing. I mean, it may take some time, but the idea that you can treat these chronic medical conditions with lifestyle and nutrition is really powerful.
Now, I know that you actually worked with the late Dr. Robert Atkins many years ago, and I know that he actually gave you funding to do research on this diet and your method and his method. And I know that you've refined your method over the years and to a point now where you have a near 100% success rate for folks that actually follow the program. So it was only a natural progression for you to come up with an online course that helps folks to implement the program without them having to actually physically come and see you. And I know that you've got a 6-month waiting list at your clinic. Now people can enroll, and we have people enrolling from all around the world.
Yes. Well, you know, I've learned from many different doctors, including Dr. Atkins. I asked him to do research, and he funded us at Duke to do some of the original or the pioneering studies on looking at the safety of this method. And it turned out that it is safe and as powerful as all of these different drugs. The refining of what are the most important elements you need to know takes time to refine it, to have the experience across lots of different people from all walks of life. But there are a few simple principles that we've kind of rarefied, boiled it down to, and that's what we offer for people who take the class.
So I know that one of the hallmarks of your teaching is, and what you've obviously done over the years is, and the refinement is that you have made your method extremely easy to follow. There's no apps, there's no tracking, there's no macro tracking. And I know that you're able to take someone from where they are now to where they want to be in 4 easy steps. And I know that that's something that you worked on for a long time. Maybe you want to chat and let people know about the 4 steps or 4-step method that you use.
Yes, the method we use is, we call it the N.E.S.T method, sort of we're teaching you in the nest, and then you're going to be flying on your own eventually. I mean, it doesn't take that long. So N is for nutrition. I mean, there's some basics about nutrition that everyone needs to know, especially if you're going to be in charge of what you're eating. So we give the basics of nutrition, much like I would teach the students or doctors who learn from me at Duke. So the basics of nutrition come first. That's N. And then E is what to eat. And we've learned that a very simple way to teach people what to do is to put it all on one sheet of paper. So the simple what to eat system is all laid out right in front of you. You have to stay to that list of foods. Now that's E. S, or different ways to start. It doesn't have to be complicated. doesn't have to be difficult. You don't have to have an app and write out everything you've eaten for the day or the week. Now you can do that. So we talk about many different ways on how to start the program. That's the S. And then T, training your mindset, or getting comfortable with a new way of looking at food is really important to help you come to grips with the fact that this probably goes against everything you've learned. If you've been following the mainstream programs, this may seem different. It's kind of like I'm teaching someone to drive on the left-hand side of the road when they've always driven on the right-hand side. So there are things you need to get used to, and inevitably you or your doctors or your family will have questions about the healthfulness and all that. And so that's kind of the paradigm shift, the training your mindset to make sure you understand at the level that you want to know how that it is healthy and it is a good thing to do for a short term or for a long term, depending on what you want to do. So that's the N.E.S.T method that we've boiled down through the years that pretty much works for everyone who wraps their head around and does it.
Now, I know that there's a lot of frustration for folks out there. There's confusion, and we aim to try and clear up a lot of that confusion. I mean, there are literally hundreds of YouTube channels and blogs and Facebook posts and groups that you could follow, and there's such conflicting information out there. But I know that for you, it's very, very important that the foundation is correct from the beginning. Why is that?
Well, again, it boils down to good nutrition and doing it in a healthy way. Now, my training and what I've learned as a past president of the Obesity Medicine Association and as a professor at Duke University now for 30 years is that you have to be careful with nutrition, to make sure you're getting the appropriate type of nutrients that you need. But the method I use has been around about 150 years in terms of the low carb nature of a program like this. And the idea of keto distracts a lot of people, distracts them into the product purchasing and thinking you need to buy these products or pills or drinks and all that. And that's not the method we use. We use a keto approach that is basically real food, not fake foods and things. It's a double-edged sword to have the popularity of keto make it so loud and popular, but it also has brought in people who are selling products that you don't really need, and it just complicates things and it gets people off track in many cases. So we boil it down to what you really need to know and what really works.
Now, I know that the course is only available for a few days every couple of months, because over and above the lessons, it also includes, and those lessons, I think, if I'm correct, if I remember correctly, there are 4 modules with 12 video lessons, but also it also includes 3 weeks within a private Facebook group where you go live and you offer Q&A. And I know that it's important for you to give real value to your students.
Yes, there are a lot of people who have tried this before, it didn't work, or they're shy about starting, don't know anyone who's doing it. So the idea of helping you not only with the information, but also the real-time support as you get started is really important to me. So I've always done that in my clinical programs where I would teach and then follow up to make sure it's working. So we've made sure that that's a part of the class. So you get the information and also the personal support for people from me and then people I've trained, so that I know that you're doing it correctly and safely and in a way that really, really does work. So it's not like you're going to do another program that, it's not going to work for you. We're going to do our best to make sure that it does work.
Now, just wanted to bring something up. We did a survey, obviously, after our launch of our first Keto Made Simple Masterclass. That was in November last year. And something very interesting, we had 640 people that joined. Eric, what was the number of total fat loss in pounds that was lost over the 3-week period?
Well, so we surveyed people at the end of the class, and so it's only the people who responded to the survey, but of those who responded, which I think was 40%, we almost had people lose half a ton of weight. It was something like 940 pounds lost, and by self-report, of course. We didn't have people verify the scale and show us, but it's what I would expect. If people are losing 5 to 10 pounds and you have 300 to 500 people, it's going to be, half a ton of weight lost. It's pretty amazing to see. It really does work.
And one other thing that was very, very, should I say, it was surprising to see is that there was a very, very good mix of people that had been on a keto diet for sometimes even years. So it wasn't just beginners. I think it was about a 50-50 mix of people that were just beginning keto and other people that have been doing it for a long time. And it was just incredible to see how many people that have been doing it for so long had so many aha moments and were awakened with the simple knowledge that they gained from the course. Now, I know that enrollment opens for the Keto Made Simple Masterclass on the 21st of January. If you would like to learn more or join the waitlist, you can do so by going to adaptyourlifeacademy.com and click on the Keto Masterclass link at the top of the page. We'll also add a link in the description of the video. Eric, thank you very, very much. We obviously appreciate everything that you do. And as always, if you enjoyed this video and you would like to see future videos, you can find us on our YouTube, Facebook, Instagram, and Twitter accounts under the name of Adapt Your Life. Eric, thank you so much. I really appreciate it.
Well, thank you. I'm excited to get the next group going.
And until next time, our next conversation with Dr. Westman, this is us signing off. Until next time. Thank you, Eric.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.